We first started looking into doing this type of biopsy a couple years ago, and took sort of a tour de force to pull it all together. But when you're doing something like this, you need a team of people because it involves not just the surgical end, but also the diagnostic end. So we reached out to some of our partners in the radiology department and came up with a team to sort of move forward.
This technology is really wonderful because it gives us an advantage when we go forward with the biopsy. So we know if there is a suspicious lesion to start with. So this is particularly helpful in patients who may have had negative biopsies in the past, but there is really significant clinical concern that they may have a malignancy. This might help us to find the lesions that are in locations that aren't typically biopsied. It can help guide the urologist. As a radiologist, my role is to interpret the MRI, find the suspicious lesion, and then indicate a region of interest for the urologist to target.
This is actually a new technology within our department. We'd always been involved in imaging the prostate and trying to determine where the cancer is in the prostate gland based on MRI, but this step took it to a higher level to actually not only identify the cancer, but also mark it on our images so that these images could be imported into the technology that the urologists have.
Patient comes back for a biopsy like they would in any other setting, and why they have the transrectal ultrasound in the rectum, there's the ultrasound monitor. What's unique is they have a separate computer monitor, and that computer takes a picture of the ultrasound prostate, and it lines it with the prostate MRI picture, and then using that onlay MRI imaging fusion, we can use a live ultrasound picture to guide the needle into the proper spot and take a biopsy.
So, one of the reasons that we do academics is because we want to innovate and we want to stay on the leading edge. And so that's always been an important part of my career and something that I've always tried to obtain throughout all of my clinical programs and research. And so to me, it really means a lot to be chosen for this award because it shows that we really are providing technologies and new care pathways for patients that are improving their outcomes.